Hi everyone, it's Teresa from Slow Paths Wellness, and today I'd like to share a practical guide to one of the symptoms that a lot of people have, especially those with chronic illness or who take a lot of medication, that can sometimes be a little embarrassing. The problem is constipation. Now, it turns out constipation is one of the most common symptoms that people have, but they often don't talk about it because, well, it's a little embarrassing for people. Constipation tends to happen. Well, first, a definition. Constipation is having 3 or less bowel movements a week, having them be difficult to pass, or having them be dry or hard. And it can be chronic or it can be short term. There are lots of different things that can cause it. A lot of medications have it as a side effect, especially pain relievers. So that's one of the reasons why a lot of times in pain management, your doctor or your specialist will want to have you switch off of pain medicine whenever possible. And that's one of the places that I come in a lot, because acupuncture and lifestyle medicine can do a great deal to diminish pain and let you either diminish or completely eliminate pain medication. That by itself can often cure constipation. Another thing that often happens is if people are either eating not enough fiber or enough fiber but not enough water with it, that can also cause constipation. In order to be able to have your bowels move properly, your gut needs fiber, because that's how it kind of massages the colon and helps things to move through. Another problem that comes up is if you're not exercising or unable to exercise, that also causes problems, because when you move, that actually stimulates your colon and allows you to go to the bathroom more easily. So if you have chronic constipation, here's what I do for people in my clinic who are dealing with that. The first thing we do is we both increase water, but we also make sure you're getting enough electrolytes, because if you don't have enough electrolytes, especially magnesium, then the water just kind of goes through you and goes through your urine. It doesn't actually get into your colon. So you want things that will pull water into your colon. Magnesium will do that. That's why magnesium citrate is one of the laxatives that they use when you're having a colonoscopy or something like that. That's one of the choices that's out there for that. Fiber will do that. Fiber pulls things into your colon. Blackstrap molasses will do that, and that's partly because of the sugar and partly because of the other things that are in it. It will pull water into your colon and allow you to go to the bathroom more easily. So that's the first thing that I suggest to people, is to get those basics out of the way. Make sure you're getting enough water. There is a little bit of disagreement about exactly how much water people should have. Most people say around 8 cups per day, and that some people say that includes having things like coffee or tea, and then other people say, well, coffee is a diuretic, so you actually lose water. So if you're getting much less than 8 cups a day, start there. Work your way up. You can add a little lemon to it. For many people, that helps with stimulating things so that you're able to go to the bathroom more easily. Also, making sure that you're eating foods that not only have fiber but have a high water content. So if you're eating a lot of fruits, a lot of vegetables, you're eating things that are soaked or boiled so that you're getting more water in there, that's also helping, giving you just a little bit more water and more fiber, which also helps. So the first thing is to get enough water. Second thing is to get enough fiber. Most recommendations are a minimum of 30 grams of fiber, and most people do not get that unless they're purposefully eating a whole foods diet. So, and also it's important to get that fiber from food whenever possible, because we now know that in addition to fiber helping your colon allow stool to move through your colon like it's supposed to, it also helps your friendly bacteria to grow. And those bacteria also help to make the chemicals that stimulate your colon to be able to move stool through your body, as well as everything else. It helps you to absorb nutrients. It helps your immune system to function better. They've actually done lots and lots and lots of research showing that it helps mood. It can improve your ability to be less diffident or less timid or less afraid of taking on challenges, and it can help you to be more calm, less likely to be anxious or depressed, either one. So and fiber is the primary food for those bacteria. So getting food that is high in fiber, high in water content, getting your water content, and then some of the other foods that are high in fiber and are very good for you. One is beans. For most people, beans are a wonderful, wonderful food. Sometimes there is a little bit of an adjustment period, because that extra fiber your body will want to be gassy. So sometimes they say it takes about 2 weeks for that to kind of settle down, and you can inch up. You don't have to start immediately going from 5 grams of fiber a day to 30 grams. In fact, don't do that, because you're much more likely to increase your problems with constipation if you do that. adding some fiber. Beans are a good source. Leafy greens are a good source. Most vegetables, especially the ones that have a little bit of chew to them, most fruit is a very good source of fiber. So getting your fiber, getting your exercise as much as possible. Now I know one of the big problems is you have people have constipation after surgery, when even though they do encourage you to get up and move, sometimes it's harder to do that. But do what you can. So if your doctor has said, well, you have to be on bed rest, which people almost never do anymore with surgery. Usually the day you have a surgery, no matter what the surgery is, they want you to get up and move around a little bit. But if for some reason you actually are told not to do that, then move whatever you can. Ask your doctor, is it okay for me to move my legs a little bit? Is it okay for me to move my hands? Now, that's not getting down to your colon right away, but it's increasing blood flow. And doing just that little bit will help prepare your body for more movement later. Now, if on the other hand, your doctor does recommend exercise, that getting up right after a surgery or right after an injury and moving around, and it just doesn't feel great, do what you can. Do your best, because that's going to solve problems down the road, and it's going to solve a lot more problems than just dealing with constipation. It will diminish the chances of blood clots. It'll help things not to swell up, help water to move through your body rather than settling in different places and causing swelling, which can increase your risk for infection. It also improves your immune system function, which helps things to heal faster, and improves blood flow, which lets blood get to the area where there was a surgery or where there's an injury so that it can heal better. So those are the primary ones. So getting your water with the right electrolytes, which you can either get by taking a supplement, which I usually don't recommend, or by the foods you eat. High fiber foods, especially foods that have some healthy plant-based fats, things like pumpkin seeds, walnuts, nut butters, and then beans, of course, being one of the big fiber-filled foods out there. Whole grains also can be very helpful for that, but in that case, make sure they're whole grains, because sometimes you'll get something that's labeled whole wheat, and if you turn it over and look at the fiber on it, it has 1 or 2 grams. You want something that is literally whole grains. So you want your piece of bread to have minimum of 3 grains per slice, or 3 grams of fiber per slice, and more than that is even better. So, do some label reading, look and see what's there, or make your own. When I make bread, I do gluten-free eating, so I do half rice flour, which does not have a lot of fiber, but I do half flaxseed meal, which has a lot of fiber, and I put those together, and that gives me a very tasty, very healthy, very high fiber bread that I can eat. And that's one of my major whole grain things that I eat, especially when I'm having lunch or something where I'm kind of trying to carry stuff back and forth. So, just get back on track here. We have get your water intake with the right electrolytes, get your fiber intake up, and you want to shoot for 30 grams minimum. A lot of people now are saying that the ideal for like the perfect health scenario is 100 grams of fiber. That's what a lot of people in cultures that eat mostly plants-based and mostly things that they grow themselves, that's what they eat. And that tends to be, they have much, much less incidence of things like colon cancer or diverticulitis or IBS or Crohn's disease. And sometimes that's in spite of living in a culture that has a very high stress rate. So in spite of the stress, things that we associate like IBS symptoms being associated with stress, they don't have, because they have all this fiber, so their body's able to work properly, and the fiber works in more than one way. We'll talk about fiber as a nutrient in another talk, because that is a huge subject, and we just want to talk about constipation today. So fiber. Exercise, doing what you can, especially things that you will feel moving your lower abdomen as much as is possible and as much as your doctor allows. So that's why with babies, if they get constipated, they have you take their little legs and do like a little bicycle motion, because that bicycle motion helps to stimulate their colon so that they're able to go to the bathroom better. And then the final thing to look at is look at your medications, because just about every single medication out there has constipation as a side effect. So talk to your doctor about it. If you're having a lot of trouble with constipation and you're taking medications and you find out either from your pharmacist or from Dr. Google that constipation can be a side effect, talk to your doctor about it. Tell them that you would prefer to not have to take a laxative to moderate that. You'd prefer to find out how to make your body work better on its own. And so you can ask, is there another medication could we try? Or what health parameters would I need to look at to maybe not need this medication anymore? Because sometimes there are medications that with lifestyle changes you can get off of. That's something that a lot of times happens in my practice. I obviously don't tell people to cease taking a medication because that's out of my scope of practice and not my expertise. But we do talk about how to talk to a doctor, how to talk to the person that prescribed the medication to you, and say, okay, so if my blood pressure reliably stayed at this level, could we try lowering the blood pressure medication and seeing if if the fact that I'm losing weight or I'm eating healthier or dealing with my stress better has maybe not need this medication as much. And pain medication, of course, is the ideal subject for that, because no doctor really wants their patients to be on pain medication all the time, because it's just not good for you, and it's not actually treating the problem, it's just kind of masking the symptom. So you can talk to your doctor, or if right now that's an iffy conversation because you're afraid of the level of pains that you have right now, you can go to an acupuncturist, you can go to a functional medicine provider, you can go to a chiropractor, you can go to a massage therapist, any of the people that deal with chronic pain, and start a program. Start just a small exercise program if you're not already doing that. Look into foods that cause inflammation and can irritate pain. Foods like turmeric actually do the opposite. They can help minimize pain. In some cases, they've been shown in studies to work at a similar level of pain reduction to something like an NSAID, like a ibuprofen or something like that. So there are lots of options. So talk to your doctor, tell them I want to start the process of getting off of this pain medication, and what can you offer me, or what do you suggest to help? And that way you can take away the primary cause, if medication is the primary cause of your constipation. And once that starts, and once you do that, then that will fix the problem. You won't have that problem anymore. Now, what are some of the benefits of not having constipation? Well, the first one obviously is you just feel better. Not being able to go to the bathroom feels horrible. You don't want to have that feeling. You don't want to go through that, and people laugh at it who haven't really experienced it. But when you've experienced it, you know it's really miserable. It also greatly reduces your risk of colon cancer, because having stuff just sitting in there that's not moving around, not getting out, the colon's made for toxins to get out of your body, and if they're just sitting in there, they're not doing what they're supposed to do. They're feeding they're feeding the wrong bacteria, because it's not to be too nasty, it's fermenting in a way that's not healthy instead of in a way that is healthy. It'll allow you to get those things out. In some cases, it allows weight loss, not just because literally you get stuff out of you that's in you, but because you're digesting your food better. When you're able to digest your food better, then you get your nutrients better, and you're less likely to store things as fat. So those are just a few of the benefits. Now, maybe that'll be another talk as well, to do a longer talk about that. Now, one thing that is a Chinese medicine thing that I do recommend to people that you won't necessarily find on other resources is to try to have most of your food room temperature or warmer, and if you're dealing with constipation, warmer is better. Warm liquids, liquid-based soups, as I said, things that are boiled instead of baked or fried. Those kinds of things are much, much better for your system. And from a Chinese medicine perspective, we say that warmth allows movement to happen. And in Chinese medicine and Ayurveda and a lot of traditional medicines, they recommend simple things like a cup of hot water with some lemon in it every single morning. And I've had patients who have been chronically constipated for decades, and adding that into their routine, some hot water with some lemon, they said that one thing seemed to make a really big difference in their life and helped them to be able to go to the bathroom in the morning. And then once they kind of started out on the right track, it was easier the rest of the day. So this has been a quick talk on some things you can do if you deal with constipation. Now, a quick caveat: if it's chronic, if trying to take laxatives does not help, if you have bleeding, or if you have severe pain, or if it's not chronic, it's sudden, then go to your doctor. Get something checked out. There might be something going on in there. I myself actually had a bowel obstruction last year, and I can tell you that it's kind of creepy. You don't really know what to think when suddenly something isn't moving like it's supposed to, and in my case, it wasn't a complete obstruction, so I didn't realize what it was for a little while. So if you're having a symptom, then you think something is wrong here. This isn't just a basic symptom. Go to your doctor. And don't necessarily stop going if your doctor goes, constipation, don't worry about it. You don't want to, there is a balance. You don't want to be pushing for something when test after test after test shows you there is nothing wrong, and so maybe there's something more holistically oriented that we can do that can help get the system in place. But you also want to make sure that if you feel like testing is needed, that you get testing. You get a colonoscopy, or you get an endoscopy if it feels like something's blocked further up, and talk to your doctor about it. You don't necessarily want to be haranguing your doctor. They are more the experts. They know a lot more about that testing stuff than I do. But I also know, because of my own experience and experiences that patients have had, that sometimes when you first say, I'm a little constipated, I don't know what's going on, it seems like it's harder than it ought to be to go to the bathroom, they diminish it. Whereas if you say, look, I'm having serious pain, this is not normal for me, or this has been normal for me for so long and I've done the things that should have helped it, then you're explaining it in a way that they can see, oh, this needs to be escalated. We need to at least make sure that we don't have a growth or a blockage or a major like bleeding from the stool or something like that, internal bleeding, that we've ruled out the things that could be bad, and then we can treat it as just constipation. So being able to advocate for yourself and know your own body and honor what your body tells you, that way you'll be more likely the things that are just a chronic lifestyle issue you can address, and the things that when something actually is seriously wrong, you'll know, and you'll be able to communicate that well to the people who can help you. So I hope this has been helpful, and I hope that if you have constipation, you can use these tips. And if it seems like that's still not doing well, you can talk to your doctor. You can talk to me if I'm in your local area, or if you're in a state where we can do health coaching, or you can reach out to someone local in your own area who does acupuncture, or who does functional medicine, or lifestyle medicine, or holistic, or integrative medicine, all of the different names for trying to have your body work the way it's supposed to do in order to fix a problem, instead of trying to just kind of mask the symptom or knock out the symptom without dealing with the problem in the system itself that's wrong. Have a wonderful day, and I hope you can be healthy.